medications for my patient. My patient is a post-appendectomy patient. The medications ordered by the doctor are ketorolac, rocephin, and acetaminophen or Tylenol. The ketorolac is going to be an IM medication or an intramuscular medication. You can give it either in the deltoid or in the vastus lateralis. In this case, we'll give it in the vastus lateralis because it is 1.7 mLs, so it has to be drawn up twice. I would also have a second nurse there for 2 drops. The second one is rocephin, and it's an IV. So that is prepared right here, and it would hang on an IV. And then your third is acetaminophen or Tylenol. It's 1 suppository, so this suppository is going to go inside the rectum. And so I'll just drop the ketorolac, which is this one. .7 mLs. Okay, 1.7 mLs. And then, so here there are for acetaminophen suppositories. It'd just be 1 suppository. And then, like I said, this is just an IV drip for your rocephin. And now I will begin with the assessment of my patient. So I'll perform hand hygiene, and for a visual assessment as I walk in the door, I'll look at my patient and see are they good or bad. My patient in particular, I would say that they are probably in between good and bad. They're probably in a lot of pain. They're a post-appendectomy patient, so they're probably in a lot of pain. I'd close the door for privacy and walk in and introduce myself to the patient and the patient's family. So my name is Kylie. I will be your nurse today. I will be doing a head-to-toe assessment and ask the parents and the patient, do you have any questions?
No.
Okay. If you have any questions while I'm doing my assessment, please ask me anytime and I can answer them.
You're awesome. Thank you.
So this patient is a 15-year-old post-appendectomy patient. She stated to me that her pain was a 9 out of 10, and so we'll just go from there. So I'll start by taking vital signs. So I would take her blood pressure and her oxygen on her finger. I would also take her temperature. Her temperature is very vital because post-appendectomy patients tend to have a high risk of infection. So their temperature may be high. Other vital signs that could be high would be their heart rate, respiratory rate, and blood pressure because of the stress on the body from the surgery, and just like I said, that higher risk of infection, so their body is just responding differently to it. Normal vital signs for this type of patient, a 15-year-old adolescent, would be their blood pressure would be, for girls, is anywhere from 107 to 110 over 64 to 66. Their normal respiratory rate would be 12 to 18 breaths per minute, and then her normal heart rate would be 65 to 85 beats per minute, and so all of those would be a little higher due to her surgery. And then I will ask her pain scale, and I would do 0 to 10 because she is an older adolescent. She is able to tell me numbers where she feels she's in pain. 0 being the least amount of pain, 10 being the worst. She tells me that her pain is a 9 out of 10. So I'd also ask the patient where that pain is generalized and like how long it's been lasting, so on and so forth. And then I'll do a quick neuro check. So I would check her pupils to see if they were, if she's got PERLA, which is pupils are equal, round, and reactive to light and accommodations, which they are. She is alert and oriented times 4. She can talk to me and speak to me. Like I said, she's just in pain. I also check her mucous membranes of her nose and her mouth. Since she has a nasogastric tube, I'd want to make sure that her nasal cavities in particular are moist because of the dryness from the tube being in there. Then I would move down to her cardiac and pulmonary area, so I'll listen to her heart and lungs. So I'll listen to the 5 points for her heart. So 1, 2, 3, 4, and 5. And then her lungs would be 1, 2, 3, 4. And then on her back as well, if she was able to turn for me. Her heart sounds are good, and her lung sounds are also good. They're just, her respiration, she's got faster respirations, which is normal for a post-appendectomy patient. Then I move to her genitourinary and gastrointestinal tract. So I'd listen for normal bowel sounds in the 4 quadrants of the abdomen. So listen to her 4 bowel sounds, 1, 2, 3, and 4. And for this patient, I'd be very careful when I'm listening to their abdomen because their incision site is on their abdomen for their appendectomy. So I want to make sure there's no bowel sounds, but also being very careful as I listen. For this patient, I can gently palpate the abdomen to feel for distension or tenderness. If there's any distension at all, then I would notify the doctor immediately. I could also, if I had a measuring tape, I would take the abdominal girth of this patient to see if there has been any distension from the surgery. Their urinary tract. I could ask the parents, has she had any problems urinating, any discomfort when she urinates?
No.
No discomfort?
The last time she urinated was 2 hours ago.
Okay. And then I would ask her if she's had a bowel movement. Has she had a bowel movement?
Yeah, this morning.
Okay, before the surgery?
Mm-hmm.
Okay. And I also notify the parents and the patient as well that post-appendectomy patients typically have a bowel movement, don't have a bowel movement up to 3 days after the surgery, and that's totally normal because of the slowing down of the organs during surgery and just the stress on the body that the appendectomy caused. And then I would move to her musculoskeletal. So I would ask the patient if she can move her arms at a comfortable rate and lift her legs and her knees for me without any discomfort. And inform this patient and the parents that during hospitalization and when she goes home, when she discharges for home, she needs to try and ambulate and move those muscles at least 3 times a day to gain that strength back from being stuck in the bed after this procedure. But she also needs to be aware of no heavy lifting of 10 pounds or more for at least 3 to 5 days to prevent straining on that abdominal area to rip in case of ripping any stitches or just any discomfort or pain otherwise. And then I'll check her skin, and her skin seems to be completely intact. The turgor is normal. Her skin, the color is normal, warmth. I'd also check her grip. So I'd have her grip my fingers on both sides bilaterally. And then I could also do her feet and have her extend her feet for me and her ankles. Back to the vital signs really quick. Checking for a pulse, I would check in 4 different locations. So I could check on her, I could check for a brachial pulse bilaterally on both wrists, and then also a pedal pulse on each foot bilaterally. And then as I'm checking her skin, I would check her abdominal area and change the wound dressing and make sure it's clean. Assess the skin around it for any redness, swelling, just any sign of infection. And then check her IV site. So she has an IV in her right hand. And check for any phlebitis or inflammation, and it seems to look just fine. Make sure there's no kinks or anything in the tubing for the IV. And then this patient also has a nasogastric tube. So she has this placed because she is currently NPO status after this surgery. She's NPO to reduce the risk of vomiting any stomach contents that she may have in her stomach.
Okay.
And we want to keep her on this. So the nasogastric tube is also on a low intermittent suctioning, which means it's taking out stomach contents from her stomach, so that there is no greater risk for infection in any other organs of her body.
Okay.
And so we keep her on that. And it can also be, and the IV is placed for to help with that fluid replacement from that fluid loss from losing the stomach contents and just from the surgery itself. Do you have any questions thus far?
No, thank you.
Her psychosocial status, has she been awake and talking after the surgery? Has she been?
She woke up about 2 hours after the surgery. It was pretty gradual, but she's been talking the past hour or so.
Okay, perfect. So, she's been talking with me, interacting with me. She seems in a decently pleasant mood. Besides the pain that she's in, that she stated that she's in 9 out of 10. But other than that, she's awake and oriented with me and can follow me and listen to what I'm telling her. Now we will administer the medications, and then do a little bit of patient-parent teaching about those medications afterwards. So, yeah, we'll administer the medications. So, hand hygiene again. So for my first one, it will be the Ketorolac. And this, like I said, can either go in the deltoid or in the vastus lateralis. And in this case, it will be the vastus lateralis in 2 different injections because it is over set amount for the syringe. So you'll thoroughly clean the surface beforehand. Allow it to dry. Or, no, excuse me, this is 1 injection. This would be 1 injection.
Where are you giving the injection?
This injection is going to go in the vastus lateralis, or the thicker part of her thigh. And we'll go in at a 90-degree angle. Into the muscle. Normally I would throw this away in the sharps container. And the second one would be this ceftriaxone or Rocephin. And this is hung IV, and it would be flowing at 5.2 milliliters per hour every 12 hours. And some things you want to watch there is just check the IV site for any inflammation, redness, swelling, rash, and some side effects that she could experience from this one would be dizziness or drowsiness. Or like I said, rash at the insertion site. And some side effects with the Ketorolac could be diarrhea, rash, nausea, vomiting. And then our last medication is the suppository, the Tylenol suppository. So we would take this suppository, and I would want the patient in the correct position. So the correct position for this kind of medication administration would be in the Sims position. So they're laying on their side in a comfortable position so that there is easy access into the rectum with the suppository. We were given her a suppository of Tylenol because she's on the NPO status and receiving fluids through an IV. A big side effect with the Tylenol suppository would be liver toxicity, and also you have your nausea, vomiting. You could have dizziness as well when administering this medication. So you'd ask your patient to take deep breaths and relax. And then I would ask Do you have any other questions for me about your daughter's care?
I don't. Thank you.
And then I would clean up my supplies, put my patient back in a comfortable position, hand hygiene, and that is it.